What are some of the biggest gaps in pediatric cancer research today?
Other than the obvious, which is the lack of funding. If we had all the funding we needed, what are the types of things we could address? We're addressing a lot of them already, luckily, through bringing young researchers into the field. So filling the pipeline, right, of new thinkers. We're funding innovative research. We're now doing these larger scale ones that are collaborative, but they are expensive. They're $5 million projects each. So looking at what we're doing now, what's on our wish list for the future, I would say more money to the really hardest to cure cancers like brain tumors in children, I would say, is at the top of the list. In fact, we're trying to put together the funds and an RFA for that. Also, looking at survivorship, like you mentioned, understanding it more. We've come a long way with survivorship support and survivorship medicine. But from when I talk to parents, it seems to me like there are significant gaps from the parent's perspective or from the survivor's perspective that really are not being met. There's an access issue. I mentioned we help families travel for care. The options you might have if your child is relapsed or has a hard to treat cancer would most likely be different depending on where you live in the country. Globally, there's a huge access issue. The survival rates in the US are probably the highest that they are in the world. In middle and low income countries, they're significantly lower. So there's a lot that could be done there to see if we can get the treatment to the kids that will save their lives. We also have on our wish list looking at disparities and outcomes. Are there reasons that some kids with the same cancer survive and others do not? That's something that's been studied, but there's probably more to be learned in that area. And then there's all the financial needs of the families and all of the resources that families need to get through this.